subscription of the Cochrane Library. So I find that working with policymakers works best when we are able to mutually collaborate and find what are the ways in which we can help each other. And that's the main focus of my interaction with policymakers, because they have needs, they have evidence needs, and we have access through the collaboration to these reviews which could serve the purpose of filling those needs. And mutually, they have resources which they could then put in ensuring that people in this country have access to the evidence. And I think that's a lovely relationship.
Prathap, you're director of the Cochrane Centre in South Asia. What does that mean? What does that entail you doing? What responsibilities come with this role?
Oh, well, it's being director of the Cochrane Centre here automatically means that we have to use this centre to further the mission and the vision of the collaboration, which is to see how we could provide reliable evidence in the form of systematic reviews to people who are seeking this evidence to inform their decision making. Now, this also means that we have to help people understand what systematic reviews are and give them the sense of enthusiasm that the collaboration actually instills in me to actually want to do some of these systematic reviews to answer questions of relevance. So a lot of capacity building across institutions, identifying people who actually have an interest and trying to match them with teams and build their capacity so they can feel that they're actively contributing to the work of the collaboration. So training is a very, very important part of our of a role of a center. And the other thing that we have to remember is that we are ambassadors for this collaboration. So we provide access to a large group of people who work to make sure that integrity in research evidence is matched by attempts to ensure that the reviews themselves are independent and free of bias. So underpinning all the work is a desire to ensure that the quality of research, the way you look at research, and the conclusions that you draw from this evidence is absolutely independent and reliable, so that when people trust this evidence and they can more readily apply it to the care that they are planning. And one of my aims in setting up as a center was to use the incredible skills of this collaboration and what we learn from the art and science of doing systematic reviews to ensure that research that's done in India, the primary studies, improve both in the quality, their methods, so that they are free of bias and they're done ethically. So it's a dual purpose, that unless we improve the quality of research done in this country, they're unlikely to be included in systematic reviews, which then totally lose their relevance to people here because our trials are not being included because they're not done well or they are not believable. So it's a dual purpose.
Prathap, we're sitting here in Big Bungalow in the Christian Medical College in Vellore, one of the premier training institutions in this country for training doctors. What advice would you give to medical students, young doctors in planning their career and what they might do in the region?
Welcome to this institution. We're always happy to have you here. And I have benefited enormously from being a student in this institution, and I've spent all my life here. And I think that one of the things I've learned from this institution is that there's an incredible amount of work that you can do in this region, in this country. And this country needs people who are willing to see that they can contribute to what happens here. So whichever walk of life you work in this country, the need is enormous. And we want all young people here to realize that they play a very, very important role. And one of the first things that they need to ask themselves is, when you become an independent clinical practitioner or a researcher or involved in health administration or any branch of the health sciences, you need to keep questioning what you're doing. to see why are we doing this? Is there any evidence that suggests that we should do something different? Because everything that we do costs. It costs in terms of resource use, it costs in terms of the harms we do people, and costs in terms of the lack of good we do. So healthcare has to be driven by some logic, not because that's the only way it has been done, or it seems somebody told you to do it. So I think the air of inquiry to find out, is this the best thing that we can do? Because we only live our lives in this way at least only once, so let's make it the best we can. And what you can then learn is other methods by which you can appraise this. How do you ask this question? What questions can be asked that can be answered? And how do you actually find what kind of evidence you need to answer that particular question? So every question can be answered best by a particular way, design, or a particular research approach. So that's something we can learn together. And the next thing you need to know is that there is a lot of evidence out there which, if only we knew where to look and how to find it, would easily answer the questions that we raise. And the collaborations work has taught me that it's easy to do this. And that's something that we can learn together and we can help each other with. And finally, when you get all this evidence together, learning how to understand whether it's complete, whether it's reliable, whether it's consistent, whether it actually addresses what you were trying to address, and then should we actually be using it? There's a process there which we all need to learn together and improve, so that when we want to discuss this with patients or with users of healthcare, we are very clear what it actually will do and how much it will help them or won't help them, so that the communication between the patient or the person that you want to help is very clearly governed by your clarity about what this does, because you know how it actually happens. So I think that's something that we really can work together. And finally, there's no escaping the fact that we have to do a lot more research, primary research, to answer questions that will benefit our people. So as you can see, it's one of the most challenging things you can think of doing with your life, and you can do it all here, and we're all there to help. So that's my advice to people.
Prathap, can you give us an example of a review that you were involved in or helped with or conducted where the result was a surprise to you?
Yeah, that's a nice question, because it's one of the reasons why I strongly believe that we need to work with policymakers and we need to work with evidence. In this part of the world, malaria due to Plasmodium vivax is a big problem, and it's a form of malaria which differs from the other severe malaria which is due to falciparum, because this one is a recurrent form of malaria. You don't develop an immunity to it, so you can get this again and again. This particular form of malaria, the parasite can hide in your liver. So you've got the circulating parasite, and it goes and hides in